Rest of the people will be visible once the Facebook link is live, or how's it going to be about?
Yes, ma'am, we are live on FB now.
Okay, so will we be able to see the participants who are joining over there?
Yes, ma'am. Yes, ma'am.
A very good evening to everyone. It's a treat to have you all join us for today's session. As we set foot into a new year, we'll also have to put our foot down together to grapple with the tough challenges that wait ahead. The current COVID implications are absolutely one of those. In the light of the same, Venkateshwar International School has organized today's rendezvous. We would like to welcome and thank our revered principal, Dr. Manisha Sharma ma'am, who made it possible to invite today's accomplished guest. Today, amongst us, we have the leading internal medicine specialist, Dr. Ashish Khattar, who has over 20 years of experience in treating countless patients in the field of internal medicine. Sir's expertise includes diabetes, geriatric medicine, infectious diseases, thyroid, adult immunization, gastrointestinal disorders, preventive medicine, endocrine disorders, and metabolic disorders. Dr. Khattar is presently associated with Venkateshwar Hospital, Dwarka, as Senior Consultant and Unit Head of Internal Medicine. Sir was also awarded the COVID Warrior Award by IMA in July 2021. We are grateful to have you on board, sir, and thank you for sparing time and gracing us with your benign presence. Parents who have joined us, it's an information. You can send your questions throughout the session, which will be addressed later by Dr. Khattar on the message box of the Facebook Live that you've joined with. Without much ado, I would like to invite Dr. Khattar for today's talk on current COVID implications. Over to you, sir.
Thank you, ma'am. Thank you, Manisha, ma'am. Thank you, Pranal, ma'am. Thank you for inviting me for this today's session. We know this that we are going through a hard time. We have seen last 2 years how they have gone before and what we are facing suddenly now. We wish that it used to be in happy times in last 6 months when the COVID cases were very less and we were patiently waiting for schools to reopen. But again, there is a sudden surge in the COVID virus again. And we find again, it is little difficult for us, for the parents, for the kids to again go out and come back to the school. Again, it is looking like a dream again. So let us discuss what is the future with this virus and what we think that what is going to happen and how we can take care of ourselves with this COVID virus which has come in. So to again, I'll start with little from the start what we have faced in last 2 years, and then we will go around with what can happen next, and are we going towards happy times again in the future. So let me start with, see, we all started COVID 2 years almost down now, and we have been sitting at home from last 2 years. It all started way back in October 2019, and it started from China. And again, now if you see that it has progressed to almost all the countries of the world, there is no one who is left alone with this. Coronavirus is actually a normal viral infection, and it used to be there before also. It has been there with us for years together now, but since it is a viral infection, please understand that it is a viral infection and mutations are very much common. What do we mean by mutation? Mutation just means that somebody changes his shirt or a new clothes. Same thing, that is what virus is doing. It is changing its different properties in the spike protein. What is spike protein? Spike protein is nothing. If you understand COVID virus like a ball, it has horns all around the ball. So if you change the color of those horns, if you change the properties of that horn, so that is called as mutation. Commonly, this mutation can happen in the common genetic material of the RNA virus, or can happen with the spike protein or any other part of the body. In other word, or in just a humor, if I say you that if you start developing 7 fingers or 10 fingers in place of 5, so that is typically a mutation has happened in a human body, and everybody starts developing these fingers. Same thing is happening in the COVID virus also. It changes its properties. So it can become better towards us, or it can become more worse towards us. So now if you see what we have gone through in last 2 to 3 years, we have 4 variants which has been commonly seen by now in the COVID virus, that is Alpha, Beta, Delta, and now Omicron. So these are just the names. Maybe in down the line in future, 2 years, 3 years, we may have a different variant with different name. Today it is COVID, tomorrow it is David. So we don't know how the things are going to go. Now we have seen how last 2 years have been. You have seen all around that whenever there used to be COVID infection, there used to be lot of hue and cry, lot of isolation, too many people coming outside your home, putting a poster and then telling you don't come out of your home. This all because COVID virus is an infectious disease. It commonly spreads through the droplet infections, that is through the saliva and through the droplets by sneezing, coughing. So it leads to spread of infection from one person to another. So hence anybody used to get infected before with a COVID virus infection, we used to tell him, please you stay in your home, don't come out, so that less number of people come in contact with you and less number of people are infected. So hence everyone was told, please stay in home. If you see how that last 2 years have gone, we have seen a lot of, I can say, a lot of pain and agony in last April and May. We have lost a lot of our friends, family members, our elders, our grandparents. We have gone through a lot of pain. I've seen a lot of my patients dying. So what happened? COVID virus, especially the Delta variant, which was the third variant, which we saw the last in April and May, it used to affect the lung very badly. It used to, see, lung is like a balloon. It is just like a machine, which is like a balloon. The main purpose is to gather oxygen. What if your lung, which is a sponge-like structure, becomes like a stone? It becomes like a brick. It becomes like a stone. There is no space inside where air can travel or oxygen can go in and then go into your blood. If there is no space, it becomes like a stone. What will happen? The lung will become dysfunctional, or it will not function what it is supposed to function. So that is what COVID Delta virus used to do. It used to hamper the functioning of your lung. So once your lung is dysfunctional, so the oxygen go through to the blood is not happening and it is not possible. So hence there was a lot of oxygen demand, because if your 80% of your lung becomes stone and only 20% is left, so you need lot of oxygen to help you with to compensate for lot of the oxygen demand of whole body. So we used to give oxygen from outside. So there was lot of hue and cry for the oxygen also, that everyone needs oxygen whosoever is infected with the COVID virus. Hence there was lot of demand of oxygen, and once your whole lung is involved, or if your body is not able to compensate for the oxygen what is needed, gradually all the organs which are interconnected, see, understand, your heart, lung, kidney, liver, they're all interconnected. So in case your lung is compromised, your heart is also affected, your liver and kidney also starts getting shutting down. So gradually all the organs get affected, and it lead to collapse of the body structure, and finally we die. So that is what used to happen. And hence there was a lot of hue and cry because of the COVID virus, what happened in April and May 2021. So post that, gradually we became better. Lot of people got infected in Delhi, and gradually there was little amount of herd immunity also. And if you see, till last December the things were very much fine. Many of us visited the hill stations also, we started going back to mall also, shopping also. So everything was becoming better, and we were feeling that schools will get reopened soon and life will come back to normal. Fine. So what happened suddenly now? Everything was looking good, everything was going better, but suddenly there was again the COVID virus put on a new shirt, a new color of the horns, what I told you, that spikes on the envelope. There was a change. So this change happened in Botswana, in South Africa in November 2021. So after this change, what was seen, that everybody was developing cough and cold and headache and body ache and little fever. So it was like a flu, what we used to get in childhood, or when you ate a ice cream or a pickle, and then you used to have a sore throat, bad in your throat, and then you started running nose. And if you would have seen many children in the class also coming down with running nose, and you used to tease them that your water is coming from your nose. So that sort of symptoms started commonly among lot of people. Suddenly one got affected, then again suddenly 5 more family members of the same family in next 3 days got affected and started complaining the same thing. So this was happening. So suddenly there was a hue and cry, what is this now? Suddenly there is then again genome sequencing was done. Those secretions were taken, whatever were coming from the nose, they were taken to the lab, and it was found that it is COVID virus again, which is leading to the problem. And then again we tried to find out what is the name of this COVID virus and what is the concern, what it is doing. So it was found that it is again COVID virus, and Omicron was just a name given to that virus. Some other name could have been also given, but it was definitely because of the genome sequencing and the amino acid chain which was commonly found, it was named Omicron. So hence, so this was named Omicron. Now, what does Omicron do, or what it is doing us currently? If you see, or many of us would have already faced it, and we would have been already facing it. So what it commonly does, it commonly starts with little throat irritation, little stuffy nose, secretion from the nose, running nose or blocked nose. Commonly people complain of headache, fever, body ache, especially backache. So these are the common symptoms what are happening with this virus variant now. It is, again I'll repeat, if you start from head to toe, it is headache, again sinusitis like pain, throat irritation, blocked nose, running nose, then fever, then body ache, then backache. So these are the symptoms what is commonly happening. So it is happening from age group of 2 to 80 or 90, whatever. Nobody is getting protection from this. All children's, neonates, that is newborns, to elderly, every one of us are getting affected of because of this. So what is the outcome of this? Commonly what we see in children's or in young adults, the illness is there for 2 to 3 days only, and it is gradually recovering off. In adults, again the same thing, 2 to 5 days. Who is problematic? in whom it is causing more severe illness. It is commonly the elderly, those who are already suffering from any diabetes, any kidney problem, any cancer patients, or anyone who is suffering from any other liver disease or any chronic illnesses. Also, diabetic patients whose sugars are not controlled, they are also prone to develop a severe illness. So hence, few things what we need to take care. Anybody who is already suffering from these sort of diseases should definitely take caution, should definitely consult to their doctor. Anybody who is diabetic should get his diabetes tablets optimized from his doctor to get the sugars controlled, and then whatever supportive treatment is required for the Omicron should be taken. That includes, if at all needed with secondary infections, some small amount of antibiotic to be added, if at all secondary infections. Otherwise, antibiotics majorly doesn't have any role. Then cetirizine or any other anti-inflammatory drug. Then if you see Otrivin like nasal sprays, Nazivion, Nasoclear, they help to relieve stuffiness in the nose. Any cough syrup for dry cough which is commonly happening, that is required. Then you should do steam inhalation, plain water steam inhalation. You should do warm saline gargles, namak pani ke garare. That will also help to soothe the throat. So these things are needed to help. Then again, to take care of the fever, paracetamol, commonly by the name of Dolo, Calpol, Paracip, and Crocin. So by Dolo, Calpol, Paracip, Crocin, they are all same. They are all, paracetamol is the name of the compound and they are all company names. So you can buy any of them. You can take it according to your body weight. Anybody who is more than 50 kg of weight can take 650 mg at least thrice daily. Less than 40 kg of weight, you can take 500 mg thrice daily. And else, if the weight is still less, you can please consult your child specialist to give it by weight. So in case somebody is not able to take tablets, can take syrup of Crocin, which is easily available in the market. So by putting this, I would say with this Omicron variant, please don't worry. It is to be nothing to be worried of currently. It is commonly affecting only the upper respiratory tract. Upper respiratory, I mean sinuses, nose, throat. It is not affecting lung majorly. It has not been seen affecting lung majorly. It is only affecting upper respiratory tract and it is going off in 3 to 5 days. Depends again on person to person. Somebody even may not witness it for one day also, and somebody is getting this for 5 to 6 days. So now one major question what arises is, what was the vaccine for? We took vaccination. Most of the parents took vaccination, even though the children vaccination from 15 to 18 age groups recently it got started. But again, then what was the use of those vaccination? Definitely, I can say one thing. Even though the vaccine hasn't protected it fully, but I still believe that it did 80% of the work. If at all we would not have got vaccination done, probably this variant also could have led to more damage. It is probably the vaccination which is actually helping you to curtail the disease only till this much level. Two, we know this that COVID virus changes the shirt and trousers and coat and pant, that is called as mutation. So you need to have changes in your vaccine also from time to time. So vaccine is just a principle to generate antibodies in your body. So what is a vaccine? Everybody is saying vaccine. What is a vaccine? Vaccine is that you took a coronavirus in killed form, that you took a coronavirus, you killed it artificially, you added into the vaccine and then you injected it. So that leads to generation of antibodies or police in your body to help you to fight with the thieves coming in. So that is, you have got your artificial police. So whenever the COVID virus turns in your body, it helps to fight with it. So that is the principle of the vaccine. But now if COVID virus only changes its property, so you need to have few changes in the vaccine also. But that all takes time because COVID virus changes its property suddenly. But then you need 3 to 6 months at least to make the changes, to have the trials so that the vaccine, whatever you are making, should not harm anyone. So all those trials are needed, and gradually the process, what actually a vaccine takes is approximately 5 to 15 years. We are doing it in 1 year. So to make it that fast and that too safe, so it takes little time. So now whatever variant has come in, I'm pretty sure that gradually vaccine changes are going to happen, and it is definitely going to take care. Now the concern is this: K, what I still feel is I'm happy the COVID virus has come back in this form and not in a severe form. I still believe because many of it's infective like anything. The infectivity rate is 70% more. It is too much infectious. One COVID patient can infect at least 20 more with the current virus strain. So if so much people will get if infected with this, so gradually the natural immunity will come up to many people, and the herd immunity will come very fast. I still believe that definitely the COVID virus surge infection is at a peak currently, and maybe the peak is achieved by the end of this month. By the end of this month, we may find that lot people are more affected, and gradually it will go off by the maybe Feb end or Feb mid. And then I feel that in case it goes off, our school may get reopened, because if everyone will get affected, and gradually the same thing we will find when the children will also get affected, the parents are getting infected. Gradually, I that's my personal feeling. There is no maths done in this. I still personally feel that schools may get reopened, because we will have lot of herd immunity, and lot of people will be getting already affected. And I still feel the way the virus has got weaker now, I still feel that it may go off in one or two more cycles, and it will land as a common viral infection in future. So by this virus, which is actually not lethal, and I haven't found anybody till now affected badly or dying, or I haven't found personally anyone. The people, those who are getting into problem, are already those who are already sick, whether they are cancer patients, or whether they are diabetic patients, or whether they are kidney patients. They are the people, those who are in problem with this viral infection also. Otherwise, normal people, definitely fever may be persisting for high grade fever for 3 to 5 days, but again that is also settling off. We have options like favipiravir, molnupiravir, other antiviral drugs also, which is helping. So need not worry. So overall, I still feel that this viral infection is definitely going to actually help us, and will help in future also to build the natural immunity. If it doesn't further changes its clothes and there is no further mutation, the thing should be fine. Now comes to what we can do. Again, the same thing. Mask. There is no other way which can be used to protect us. So mask. And one thing I have been telling before also, the mask, you should know how to use it and how to actually wear it. Wait a second. Just a second. बेटा इसका वो चार्जर जल्दी. Ma'am, wait a second. 1 second.
Sure, sir. Take your time. No worries. And in the meantime, the audience is free to send their questions in the chat section. We'll later take them up with Dr. Khattar. So please use the chat section to send in your queries.
Mrinal, we are very thankful to Dr. Khattar how simply, in a simple manner, he has explained every aspect. And I'm sure that many of our audience have questions we will be taking later on. Yes, now back to Dr. Khattar. Yes.
Yeah. Now, thing is this, actually the speaker battery went off. Just a second. Now, thing is this, we were on this mask, right? So everyone of us knows how to wear it, but we don't know how to take it off. Now, thing is, maximum most of our day goes like this, then again like this, then adjusting the mask like this, and we put our hands all around the home on our work table, and then we land to the infection spread. See, whatever is there, the dirt or the infection is lying outside on the mask. So if you're touching your mask from outside, you should actually sanitize your hands. And when you are actually coming back home, you should just pull it and throw it directly into the bin, the thing which is meant for the disposal of the mask correctly. And then you should wash your hand with soap water or sanitizer. That is how you should actually use your mask. In case you are using your mask and touching the surface outside the mask, you are actually lending to the spread of infection more. Then the mask will actually become more harmful than beneficial. So if you are using a mask which is actually mandatory, you should use the mask, but you should know how to use the mask. Otherwise, this mask will only lend to spread of more infection than actually preventing you from. Hello.
Yes, sir, you're audible now. Please go ahead.
You can take up the questions, if anything, from the audience.
Okay, thank you very much, sir, for your expert insights. It surely has braced us a lot to differentiate between the rumors and the myths to the authentic information, and also cleared the air of paranoia that we always feel by reading different articles in the newspaper and on the news channels. So thank you so much for your time. I will open the floor for the questions now. The audience, you are free to send in your questions. So one thing that has been coming up a lot is that the people are very uncertain as to when and after how long should the testing for confirmation of COVID be done? Because last time people actually rushed a lot for getting it tested. So what would you say about the testing of COVID?
Anyone who is actually getting fever, throat pain, headache, body ache can get himself or herself tested for COVID virus. In case you are not able to go out, you can do a rapid antigen kit at home. You can procure it from the chemist easily, because when there is a lot of people infected, there is a lot of rush at lab, and most of the times we find that the reports are delivered late. So you can get a rapid antigen kit at home. It is nothing. There is a swab. You can put it in your nose or in your throat, one way. You cannot use it throat and then again in this thing. And there is a solution with that. You have to dip that Johnson bud like thing in that solution, mix in that, and then throw that bud out. Put that 2 drops of the solution in the kit, and that will help you to find the results. But the problem with this rapid antigen is that in case it is found positive, you have to take it as positive. Then you need not do a COVID PCR from the lab. But in case you are having symptoms and your rapid antigen kit still shows negative, you have to reconfirm with a COVID RT-PCR test. You just cannot take it final on the rapid antigen if it is negative. Rapid antigen has a good positive sensitivity, but not negative. So in case it is positive in rapid antigen kit, you please need not do a RT-PCR again. But in case you are having symptoms and the rapid antigen kit shows negative, please take up a RT-PCR test. So that is one way which you can easily do at home. 2, again, if one family member is COVID positive, the others are showing the similar symptoms, so that is definitely probably a spread in the family. Do a rapid antigen or take up a COVID PCR test. It will help you to get the diagnosis done and help you to put on a correct medication. And in the meantime, you can consult your physician at the earliest to help you with the medications and take care. Ji.
So Sangeeta Nair in the audience is asking that from 1 to 2 days, her son has been suffering from fever, and then after 1 day, tonsillitis appeared. So can it be something related to COVID? Like, should she be worried?
Yes, definitely it can be COVID with the current scenario. See, I am not denying that normal viral infections cannot happen. Kids definitely most of the time they eat cold in still winters, and people are predisposed to multiple allergens, and they can have normal tonsillitis, normal pharyngitis also. But when we are already in a pandemic where cold, cough, fever is very much rampant, you should definitely consider getting him a COVID checked, right? So, and please take your child specialist opinion, and please go ahead with a COVID PCR or a rapid antigen test.
Sir Prem Kumar Sharma is asking that right now, is it only the Omicron virus that's prevalent, or we still are struggling with Delta virus as well?
Very frankly, 80 to 90% infection is Omicron. It is not Delta. I haven't found anybody with the Delta. Now, again, how to differentiate between Delta and Omicron? You need a gene sequencing, right? And genome sequencing. And for this, there are only few labs, few dedicated labs. And with this so much crowd and pandemic, it is very difficult to send each and every one sample to find out whether it is Delta variant and or Omicron variant. That is why, irrespective of Omicron infection, we have told 100% caution to be taken. Keep checking your pulse oximeter, your oxygen saturation, and in case there is any breathing difficulty or there are any changes in your X-ray, please immediately contact your physician or your doctor to take care of that. In one line, if you ask me if I have witnessed any Delta, no. In last 1 week, when there has been a sudden surge, I haven't witnessed anybody complaining of any breathing difficulty. In last 1 week, I would have seen approximately 300 patients, but no one complaining of breathing difficulty at all. And I haven't majorly seen any respiratory chest X-rays or CT scan, any lung changes. So I don't think so that it is mainly the Omicron only which is infected currently and not the Delta variant. But still, as we all know, that COVID virus is notorious in having mutations. And please do understand, India is a huge population where it has already come. And when there is huge population and there is lot of infectivity, the chances to rehab mutation again becomes more. Please do remember that Delta originated in India. That is what we all know. And it all started with alpha, beta, and then Delta in India, which was very harmful. So you never know, this Omicron changes again to something else. So I'll always say that be cautious, follow the COVID appropriate behavior, do use your mask and sanitizers, irrespective of whosoever says whatever. Keep using mask until unless we are damn sure that it is the COVID virus infections have settled and we can easily come out. So please follow the COVID precautions.
Sir Manoj Kumar in the audience is asking that do these symptoms always come in combinations like fever and sore throat, or it can only be sore throat?
It is not necessary that it has to be fever, cough, sore throat. Anyone can have only headache, only body ache, low-grade fever, only throat irritation, or a combination of all this. So it may not be that everyone has everything. So it may be nothing. If 5 family members are there in one family, 3 may be having symptoms. And if you check for rest of the 2, they may be positive, but they may not be having anything. So it is not necessary. It all depends on one-to-one immunity. It all depends on how much viral load and how much the infection rate. So it depends on a lot of things. The symptoms may vary, and definitely some may have weak symptoms, some may have no symptoms, and some may be terribly ill.
So Monica Mehta is asking that if somebody was in quarantine in their family and the symptoms have receded, so how long should they wait for the quarantine period to continue? And also the people who are outside the quarantine zone, what precautions should they take to prevent the...
With Omicron variant, what we have seen that isolation period, initially it was told 14 days, then 10 days, and now 7 days. But personally, I feel 7 to 10 days is good enough. Anybody who has done 7 days of isolation and no fever for last 3 days can come out with at least use double mask if you are coming out in the community for next 1 week or so.
Anuradha in the audience asks, sir, I took longer time to recover during the second wave because I'm a cancer survivor. Hence, I got my first dose of vaccination quite late and still waiting for the second dose in February. So can you please suggest about the booster dose, and is it fine if we take only 2 doses and not go in for the booster dose when it arrives?
Anuradha, vaccines are meant to maintain a good COVID IgG antibody levels. So whether you have taken 1, 2 or 3, it all depends on your immunity. If your antibodies level are very good, Even the 2 dose are enough. In case the antibodies level are not good, even with the booster dose, you may need a dose again. So I'll rather suggest that you can timely take your vaccine. As you said that you have taken one and your second one is due. Please take your second dose, and the booster, then again you will require maybe 6 months later. So currently I will say you can proceed on schedule with your second dose. You can even though check your COVID IgG antibody levels, and you will come to know how the status is going in your body.
Sir Suraj Parmar asks that somebody on the top floor is COVID positive. So what is the distance periphery that we should maintain, like going in the balcony and?
Don't worry. The Prime Minister of our country, Modi ji, has told 6 feet. So that much is more than enough for a droplet infection. Don't worry at all that if somebody is infected below you or on the floor above you, they are not going to harm you anyway. Do take your due precautions if you are walking in the lift. Don't touch the surroundings. In case you are doing so, or if you have touched by mistake, use the sanitizers, use masks. Don't worry, nothing is going to harm you.
And Shruti is asking this question. I think a lot of us are curious about this. When are the vaccines for children finally coming to India? So any word on that?
Don't know, because lot of approvals, because we know that after vaccination also there were a lot of complaints, people having neuropathy, some cardiac concerns, BP concerns. So definitely trials are going on. The government has opened the platform for 15 to 18 years. And that's what I said. If in case a lot of people are getting infected this time with the Omicron variant, we have already witnessed in our family also few of us, we are going to have a good amount of herd immunity through a natural immunity process. That is also very good. So maybe down the line, the way it is going on currently with the 15 to 18, maybe the next step is more than 10 years of age, vaccination for more than 10 years of age. You can expect the same maybe in 3 to 6 months of time in the coming, in this 2022. So currently there is no call from the government side for the kids vaccination. Wait for some more time till the trials are over.
Right. I think that that covers the questions that the audience has been throwing away. Thank you very much, sir, for sparing time and for enlightening us about the current situation. It means a lot. And yeah, there are lots of messages thanking you in the audience as well. So thank you very much. It was a treat having you here.
Thank you, ma'am. Same here. Thank you.
Thank you so much, Dr. Khattar, for such a lucid, crisp session. Thank you so much. We all have been benefited by it a lot. Thank you everyone for joining. Thank you so much.
And thanks a lot to you, ma'am, for kind of organizing this session for us all. This was
I'm sure we'll catch hold of Dr. Khattar again and again in
Sure.
future to have more awareness wherever there is a pang of anxiety or fear is lurking all around. Because such kind of sessions really make us more hopeful, and they also give a very clear-cut picture of that how to go about it, rather than being anxious and unnecessarily worried about it. What measures we should take, that is very, very important. So thank you, team, whoever has really contributed for this, Ms. Anuradha, Ms. Mrinal, Ms. Meenu, Pulkit, Ms. Shiva, and everyone. Thank you so much, all of you, for joining. It was a very short and crisp session. Thank you so much, everyone.
Thank you very much, ma'am, for making this event possible. Thank you so much.
Thank you.